Oh, uh, hey, don't worry about that fatty right there. That wasn't marijuana. So you think marijuana should be legalized so you can use it for your health challenges? What if I told you you could get the benefits of medicinal marijuana without the high or without the drug aspect of the marijuana, without the THC? Well, that's what I'm going to tell you. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Today I was at my barber shop getting my ears lowered. Thanks, Wally. And the question came up regarding CBD and CBD oil for anxiety and depression and mood disorders. And that led to questioning of CBD's efficacy for all kinds of things and the risk of failing blood tests. So lots of questions that probably many viewers out there have regarding CBD and medical marijuana and those things. So medical marijuana is used most commonly for cancer and chemotherapy treatment to deal with nausea and vomiting and chronic pain. But in many states, CBD oil is available with or without THC. The CBD oil that comes from hemp does not have THC or does not have amounts of THC that would ever cause you to fail a drug test, even at extremely high doses. And so why would someone take CBD? Well, CBD, which stands for cannabidiol, is a fraction of the cannabis plant that has the medicinal properties. There's also terpenes, which are believed to have medicinal properties and which give the marijuana aroma to the plant. But CBD is what's most well studied and which has the most well-known medicinal properties. So why would we use it? Well, it's been shown to be effective for joint pain, for inflammatory bowel disease symptoms, including diarrhea associated with that. It's been shown to be useful in epilepsy. So for children with seizures, it's been very, very beneficial. It's also been shown to be helpful in anxiety, depression, and neuroinflammatory neurocognitive issues. So you can benefit from the CBD without the risk of the THC and failing a drug test or being arrested. How can you take it? Well, it's available in capsules. It's available in sublingual liposomal formulations. And I learned today at the barbershop it's also available through vaping. So there are multiple modes of delivery. And from a sublingual perspective, because that's what I have more experience with. I just learned about the vaping today. But from a sublingual perspective, you want to look for between 8 and 12 milligrams per dose. And depending on what's going on, you may need more, but that's something to discuss with your managing provider. Don't go and mess with it yourself. So how does it work, or why does it work? Well, in our bodies, we have our own intrinsic or endogenous endocannabinoid system, meaning we produce our own cannabinoids. We produce our own CBD, if you will, or our own endogenous marijuana, if you will. So we have already built-in receptors for the cannabinoids. So when you take a CBD, what that's doing is that's going, if this is a receptor and this is the CBD goes and binds the receptor, and then binding that receptor causes intracellular processes to occur that can lead to the pain relief or affect the GI or affect the mood and all the symptoms or health challenges that we discussed earlier. So it's just like if you're taking Klonopin for anxiety or Wellbutrin, those are drugs that target the neurotransmitter physiology. So they're targeting the receptors that the neurotransmitters bind, and they're having their effect that way. Well, just like those are receptor-based, so is the CBD. So if you were looking for if you were speaking with your practitioner, your medical doctor who is giving you your prescriptions, and you said, hey, could we use CBD as a natural method to treat my anxiety versus, say, the Wellbutrin or the Klonopin or whatever you're taking, and therefore treat it more naturally and have a lower side effect profile? What do you think of that, doc? And get their opinion and go from there. So this is just scratching the surface of CBD and its benefits, but it's definitely a consideration, and it's available without the THC or without the drug or what's perceived as the drug effect of it. So you'll hear in the media that CBD is illegal because it's a drug, an illegal drug because it comes from marijuana. That's not necessarily true. If you do the research as to where it's being sourced from and the makeup of that formulation, you can definitely get THC-free forms, but still get the benefits of the CBD. So we will cover this further in the future, but this is the primer for today. If you're dealing with chronic pain, dealing with inflammatory bowel disease, dealing with nausea and vomiting from chemotherapy treatment, or dealing with anxiety and depression, you may benefit from CBD, and I would ask you to bring the topic up with your managing practitioner and comment below with your experience.